Oh yeah, yes, Candy, you're welcome. Anytime I can cover you for a shift, or if you need help with patients, I mean that's what teamwork's all about. Big into helping the team. Yeah, you're welcome. I'm just a team player. Yep, sure. All right, so I need to give Dr. Malloy a call and make sure I got all my SBAR notes. Yep. All right. Hello, Dr. Malloy? Hi, this is David in North Wing. Yeah, 5 North. Yep. Cardiac telemetry unit. Yep, absolutely. Yep. Well, yeah, but I'm actually in the ED department now, and I just want to get just a few moments of your time to do an SBAR on a patient. Okay, excellent. So the situation is I'm calling you about William Mason, and he is a full code. The problem I'm calling about is he's hypertensive and in shock related to blood loss from a gunshot wound. And I'm concerned about perfusion as this patient is bleeding out. It was in the emergency department, admitted. His date of birth is 10/13/46, age 75. He's a male patient. Admission date was 12/25/21, and attending physician was Dr. Canaday. Vital signs are blood pressure 109/52, pulse is 45, respiration is 28, and temperature is 98.9. There's no other allergies to any medications other than just strawberries, and that reason for the visit is the gunshot wound that entered in the left chest abdomen area, reported in the ER as the point of entry for that chest abdomen wound. And I'm really concerned about the blood pressure because it's extremely low, as I've noted in the vitals. Respiration because it's compensation for the high cardiovascular loss. Background is it's a history of traumatic pneumothorax due to that gunshot wound to the chest. The patient's mental status is confused and non-cooperative with police deterrent on the scene. He's agitated, the skin is pale, and the extremities are cold. The patient is on oxygen. Patient has been on 6 liters per minute for 8 minutes now. The oxygen reading is 90%. The assessment is the problem seems to be cardiac and respiratory in nature, with a vascular compromise, and the patient seems to be unstable and maybe getting worse. We certainly need to do something about that. I'm sure you would agree. Current temperature, vital stats, we have 98.9. Initial heart rate was 45, respiratory rate is 28, and then 109/52. His diet is a standard American diet. Restraints are on due to his criminal involvement, so he does have a handcuffed left lower leg to the side rail. Ins and outs is about 500 milliliters of sanguineous fluid lost. IV access is peripheral venous catheter, right cephalic. Accu-checks are 88 milligrams per deciliter, and that is a fasting value. We saw no need for a VTE prophylaxis, none given due to being a surgical patient, and no immunizations are reported at this time. The pain was sudden and pleuritic. Cardiovascular is hypotensive and tachycardia. We have continuous telemetry monitoring. The rhythm is fast and thready. Respiration, breath sounds are diminished. O2 is 6 liters per minute. Bowel sounds are decreased, and no bowel movement has been reported in the last 2 days. Skin is altered via a bullet hole in the chest and abdomen region on the left, with no apparent exit wound. Wound care was a pressure dressing, and pressure ulcer prevention is not applicable. For recommendations, recommend a plan of care of surgical bullet removal. Discharge plan would be to send to St. Johns County Jail Hospital for recovery when patient is stable. And we have a continuous lactate ringer IV running. I request that you come to see this patient at this time, if you will. The tests that would possibly be needed are thoracic CT, chest x-ray, ABGs, thoracocentesis, and if a change in treatment is to be ordered, then I would want to know how often you'd want these vital signs, and if the patient does not get better, when would you want us to call you again? Oh, well, thank you very much. Yeah, I like to be very thorough and very detailed in my SBAR transfer information, both with the medical doctors, DOs, ARPNs, and staff. So I really do appreciate that. Thank you very much. Yeah, thank you. I felt welcome for the last couple weeks here at this new assignment. I thank you very much for that. Yes, is there anything else? I know you're really busy and I don't want to keep you. Okay, perfect. Well, I will look forward to your call then. Thank you. Bye.